On the surgical side, though, not all operations are equal. The most common operation done in the United States is called the Nissen fundoplication. The problem with the Nissen is, in my opinion, is that the side effects sometimes are almost as bad as the symptoms of reflux. Patients who have a Nissen, they tend to not be able to burp. They can't swallow easily, and if they ever get nauseated and have to vomit, they can't vomit. So it makes the valve more of a one-way valve and not enough of a two-way valve to relieve pressure in the stomach. So the operation I like to use is called a Hill posterior gastropexy. I do a variation of that, and it's much more physiologic. It allows more two-way movement so patients can burp and they don't have the trouble swallowing that associated with the Nissen. And if they need to vomit, then they can without tearing everything up. So it's much more physiologic, and therefore patients are happier with that surgery. It can be done as an outpatient, and usually within 2 weeks they're eating normally and usually back to normal activity in a few days. So when you look at long-term durability, there is association with weight. Patients who are heavier are going to have a higher chance of recurrent reflux than patients who are thin. Maybe if they're weightlifters or doing real strenuous manual labor, they might be more prone to recurrence. But generally, thinner patients, less chance of recurrence.